I'm Catherine, and today I'm going to be talking about a technique called dry needling. A lot of people ask me what is the difference between dry needling and acupuncture, and the answer is that acupuncture and Chinese medicine developed first and dry needling developed separately from that. But with acupuncture and dry needling, we use the same solid filament needle to perform the technique. The difference is that with dry needling, we're specifically targeting sore muscles or tight spots in muscles called trigger points. So I'll quickly explain what a trigger point is. It's a knot in a muscle, so you can feel it. It's like a tender band within a muscle, and it's quite irritable. When it's pressed, it can refer pain to other areas, and often when people come in, we are testing those trigger points to see if it provokes their familiar pain, which they're coming to see us about. So with dry needling, we needle those trigger points to essentially reduce pain and improve movement in an area. You might be wondering, well, how did I get the trigger point in the first place? Trigger points can be caused by a number of things, including arthritis, injury, or a muscle strain. So often when those things have happened, trigger points will develop and we can treat them to help relieve the pain. So today I'm going to demonstrate a technique for the neck and shoulder on Taylor. This technique is really helpful for shoulder pain and headaches. So I'm going to get some of my needles now. So the muscle I'm treating today is called the upper trapezius. So I feel for a tight band in the muscle. Taylor, is that sore?
A little bit, yeah.
A little bit. And I've just tapped the needle in. Then I'll slowly poke that needle into the muscle. Once the needle's in there, I can move it around. And I call this fishing for a trigger point. So Taylor might feel a little bit of an ache or a muscle twitch. Can you feel anything there, Taylor, at the moment?
Yeah.
Yeah. And sometimes if the muscle twitch is really big, you can actually see it on the surface of the skin. So I'll usually do this for 30 seconds and then I'll leave the needle in if it's practical so it can continue to work on that area. Usually I'll do both sides, depending on where the person's pain is and what their symptoms are. So the idea is that this needling technique will reduce Taylor's perception of pain in his central nervous system, so the brain and spinal cord. So we're treating a muscle, which is a peripheral source of pain, to reduce his perception of pain in the central nervous system. And this should help him to have increased movement, reduce pain, and reduce muscle tightness, which I think are all very good things, and Taylor will probably be pretty happy about that. So dry needling doesn't replace other manual techniques like manipulation or massage, but it's very specific and it's very efficient and fast, which makes it a useful technique in osteopractice. Thank you for listening, and if you have any questions about dry needling or any other treatments that we offer here at OGOSH, please don't hesitate to give us a call or check out our website. Thanks for listening.